Welcome back to the Morning Blend. Are you at risk of a heart attack? This morning, we're going to dive into the details on what exactly can trigger one and how you can reduce your chances of having one.
That's right, Dr. Keith G. Boman. He is a cardiologist with WellHealth Cardiology, and he joins us now with more. How are you, doctor?
Great, glad to be here.
Talking about a positive subject today. This is something we all have to shine a light on, though, because this just ends up affecting so many of us. 43 seconds in the United States, every 43 seconds, someone has a heart attack.
Wow.
Explain what a heart attack is, and maybe the difference between what a heart attack is and what a stroke is, because I think people get confused.
Well, essentially, a heart attack to the heart is the same as a stroke to the brain.
Okay.
It's the same process. So what we talk about today with the heart would actually apply to someone who had a stroke.
Okay.
It just affects the brain and not the heart.
Okay.
So a heart attack is essentially a problem with circulation to the heart. As you know, the heart has its own arteries that supply it, and they're very small, 3 millimeters.
No
Very
kidding.
small.
Wow.
There's
Wow.
4 or 5 of them, but they're very small, just like the end of your pen.
Yeah.
And over a period of time, as we get older, we develop plaque. It's called atherosclerosis in those arteries. And generally, the plaque, you won't know it's there. It doesn't cause a problem. But as the plaque grows, sometimes one of those plaques splits or cracks, just as if you were to cut your finger.
Yeah.
Yeah.
What would happen if you cut your finger? You get a clot.
Yeah.
Well, what happens inside the coronary artery is the body doesn't know it's your finger or it's inside your heart. It doesn't know the difference. And a clot then forms on the plaque.
Oh, no.
And when that happens, it occludes the artery.
Yeah.
Now, it doesn't take much plaque because we're only talking 3 millimeters.
We have a model here.
Yes, we do.
So this is blown up for scale for us.
This is really blown up for scale.
Because I'm thinking maybe, you think of the heart, you think these are going to be these huge arteries, but it's not quite
Well,
the case.
this is really quite impactful, the way this is presented.
Yeah.
So the first presentation here is a normal artery. You can see it looks clear. There's no yellow plaque. Plaque is made up of calcium, fat, and other components, which you can actually see on X-ray from time to time.
Wow.
Now,
But,
this is where you want to be.
This is where you want to
Yes.
be. This is where you don't want to be. So the process that occurs that I was just explaining is the plaque builds, as you can see here. It doesn't really cause a problem, but then what happens is the cells that cover the plaque split or become unstable, and the body thinks you've cut yourself.
Wow.
And so it sends clotting material.
It's trying to protect itself.
Exactly.
With that,
it doesn't know the difference. It's fascinating.
Yeah.
And we didn't even know this 25 years ago. We didn't know what really caused the heart attack per se. And then as you can see from the final presentation here, the red clot then blocks the artery. So now there's no blood that goes past that clot, and the heart tissue that's distal to that clot doesn't have any oxygen, doesn't have any nutrients. Now remember, the heart, it doesn't rest. It's always beating.
Yeah.
So it doesn't take long for the heart to say, give me some oxygen, give me some nutrients. And what happens is now it goes into a state called ischemia. It's not getting enough oxygen. And if that lasts long enough, 5-10 minutes, you start to have cardiac tissue that dies.
Oh, wow.
That's a heart attack.
Wow. My goodness. There's a lot of information.
We're trying to keep it simple.
Of course, but that's what it is. I mean, it's more than I've known about heart attacks
Yeah,
going into
it's really quite simple, but quite complex in the physiology. But it's simply a plaque and a clot that occludes a small artery in the heart that causes a heart attack.
Wow.
So that is what is going on in the inside. And thank you for that explanation, because I thought it was really practical. What's going on the outside? How do I know if I'm having a heart attack?
Some people don't know. There's a certain percentage, and it's low, that can have a silent heart attack. They don't have any symptoms. But let's talk about the symptoms, because I think that's where we're going.
Of course.
Generally, you will have chest pain. Remember, chest pain is probably the #1 reason why people go to the emergency rooms. And just by history, we can get a pretty good idea, is it your heart or not? So let's talk about the chest pain that's consistent with a heart attack that we're talking about. The pain is usually at rest. You're usually a little bit sweaty or diaphoretic. The pain itself is generally substernal in the heart area, but doesn't have to be. It usually radiates sometimes to both arms, the left arm, the neck, or the back.
Oh, wow.
And there's usually some nausea associated with it. And it doesn't go away in 5 minutes. Most people describe it as a heavy pressure. But it doesn't come, it doesn't go usually. It's usually continuous.
Steady.
Now, the key is to get an electrocardiogram, because the EKG will show the ischemia we talked about. It'll show it, and the diagnosis is easy at that point to make.
Yeah.
In some cases, if a paramedic is called, they can actually do an EKG on site.
No kidding.
No kidding.
Wow.
Send it by telemetry to the emergency room so that we know that they're going to bring that person in and he's having or she's having a heart attack.
That's incredible.
And do appropriate therapy.
Technology's come a long way.
It has come a long way.
That's pretty.
As long as it works.
Well, yeah, that's right. When it does work.
Yeah.
So, yeah.
Well, I was talking to you in the waiting room before we walked in, and you said since the 1980s, there's just been tremendous advances.
Oh, yeah.
And so the information available is really fantastic.
Yeah, when I started practicing cardiology, I hate to admit this, but it's in 1980, we didn't know that this clot formation was what was causing the heart attacks. It took another 10, 15 years to figure out the physiology and how that was all happening and how a plaque, cracks or becomes unstable. Because generally you don't know you have these plaques. And these plaques don't just occur in the heart, they occur in all the arteries.
Yeah.
But they're much more significant in the heart because the arteries are so small. It doesn't take much.
It's unbelievable how small they are. We have about 45 seconds left. I want to talk about how we can reduce our risk of having one.
Well, there's some things you can't do.
Yeah.
Family history, genetics, very, very important.
Okay.
But there are certain known risk factors, and I think we all talk about them on a frequent basis. Diabetes, if you have it, obesity needs to be controlled. Hypertension, smoking is probably the worst in terms of accelerating this plaque formation.
Don't
in
do
the
it.
arteries. Don't do it.
It's bad news.
It is by far the #1 risk factor that you can control in your life if you happen to smoke.
Wow, it's incredible, powerful information. Great having you.
Good to be here.
Want to be on the left of that. The left, not the right.
Yes.
This
Right,
left.
Bad news.
Right
Yeah,
here,
that
right
left. Know the signs and risks to prevent a heart attack. If you want more on WellHealth Cardiology, you can just head to the website on your screen. There's also a phone number listed. And a couple